Americans are confronting a global pandemic in their own backyard. As the wave of concerns reach Iowa, we sit down with a trio of local medical experts. We'll dive into health and safety in the era of the coronavirus on this special edition of Iowa Press.
Funding for Iowa Press was provided by Friends, the Iowa PBS Foundation, the Associated General Contractors of Iowa, the public's partner in building Iowa's highway, bridge, and municipal utility infrastructure.
I'm a dad.
I am a mom.
I'm a kid.
I'm a kid at heart. I'm a banker.
I'm an Iowa banker.
No matter who you are, there is an Iowa banker who is ready to help you get where you want to go. Iowa Bankers, allowing you to discover the genuine difference of Iowa banks.
Celebrating nearly 50 years of public affairs coverage on statewide Iowa PBS. This is an Iowa Press special edition on the coronavirus pandemic. Here is David Yepsen.
As a global pandemic spreads throughout the country, Americans are facing unprecedented changes to daily life. But many Iowans have important questions pertaining to their health and safety, given the potential of COVID-19 infection. Joining us to discuss these concerns are Dr. Jonathan Crosbie, a family medicine physician at Moines University, Dr. Rossana Rosa, an infectious disease specialist at UnityPoint Health, and Jennifer Nutt, Vice President of Clinical Services for the Iowa Hospital Association. Welcome to all of you. And I just want to thank all of you and all the first responders and healthcare providers in the state for all the fine work you are doing overtime for all the rest of us. Thank you. Also joining us at the table is Kay Henderson, News Director for Radio Iowa. Now, we've expanded our regular format on Iowa Press to a full 1 hour, and you can see the many ways to submit potential questions for our experts via online email or social media, or through our 800 number listed on the screen. We'll incorporate some of your questions into the back half of the program. Okay.
Dr. Crosbie, from a public health perspective, has Iowa done enough in terms of social distancing and closures?
No. In terms of closures, I think we've done probably as much as we can. In terms of distancing, no, I don't think the general public's probably taken this seriously enough. There's a difference between being scared and being serious, and I don't think that it's being taken seriously enough. And I understand that people need to go out and get groceries, and that's not what we're talking about here. I mean, obviously, if you need food, go get food. If you need takeout food, if your kids are really having a rough go of it and you need to go get a takeout pizza, like, I understand that, but going to places that just aren't necessary is still being done. People are still out and about when they're sick, and that's a major problem.
Dr. Ross, same question to you.
I think our authorities have provided guidance that should be taken seriously. It should be noted that this is still, even at on this day, a very fluid situation. So whether more strict measures will be needed is still yet to be determined.
And Jennifer Nutt?
Yeah, I agree with what they've said, and I think another important point, and a lot of companies are doing, is the work from home option. That's another way for social distancing to work well, especially in offices where you're in a cubicle setting, where you can't separate from each other. To be able to work from home is a good option. And or if you do have to go to work, make sure that if you're having meetings, you're sitting apart in the same room and having space between each other.
Strange question. We hear a lot of businesses, and they closed the Iowa State House for the first time in anyone's memory, perhaps in history. Yep. And they said, we're going to do a deep cleaning. What does that mean?
Well, a deep clean of the Capitol will be a big job because there is a lot of nooks and crannies there. But to really sanitize everything, a lot of businesses clean and everyone cleans, but it's is it clean to the level that's actually killing viruses. So I think when offices and businesses or buildings are closing, is to do that deep clean to truly sanitize to kill the viruses.
I would add to that, though, that cleaning is actually an ongoing process and something that we, each one of us, actually has to take responsibility on a constant basis. So to hear that a facility will be deep cleaned helps, but once people start congregating in there, it's each one of us' responsibility to wash our hands, follow coughing, in our elbow, and all of these things to actually keep these environments clean.
Same point when you go out to find the groceries that you need, that we all understand you can't stop going to certain places, and that makes sense. If you're at the gas station, bring some Clorox wipes and wipe down the pin pad, wipe down the gas station handle. When you're at the grocery store and you're signing out or signing the electronic pad, wipe that down. Wipe it down before you touch it, wipe it down after you touch it. These are the things that can help spread this sort of thing. Stop the spread of this sort of thing.
We're doing this show live, and so one of the nice advantages of that is that we have a lot of time to discuss these things. We also have a graphic that will update our viewers on just where this is being found. Jennifer Nutt, what keeps you awake at night about this?
I think right now what's keeping me awake at night is hospitals all across the state are doing everything they can to be prepared. And I think one thing nobody can answer, are we prepared enough? Since we don't know how quickly this is going to escalate, how many people will be hospitalized. And I think making sure that the social distancing, hoping that it works so that we don't get that peak, and hoping that our hospitals don't get too many patients and our healthcare system can handle it.
Dr. Rouse, same question. What keeps you awake at night about this?
Yeah, I worry about the tipping point. We have still not seen the worst of this. Our hospitals are not overflown. We're still able to deal with the influx of patients. We are still able to care for those ones who have something other than coronavirus. So I worry about that changing. And I also worry about things like operation, from an operation standpoint in our hospital, I do worry about what will be the future of our healthcare systems moving forward. Will we remain viable when we are having to cancel elective surgeries, which bring much needed income to our facilities? So I worry about the immediate future, but also about the long-term consequences for our hospitals.
I'd like to piggyback on that comment as well, especially for our smaller critical access hospitals in the state, which are 25-bed hospitals in the rural areas of our state. With them being asked and starting to stop elective surgeries, that is a big source that brings income into those hospitals. And the Iowa Hospital Association, along with our hospitals, are really reaching out to Congress, because Congress really needs to get some money coming into our hospitals. And since hospitals are the front line of this war, if we call it, our frontline hospitals need to be funded and be able to be viable.
Dr. Crosbie, what's keeping you up at night?
Everything, I would agree with everything they said. Of course, I think maybe some people are under the impression that the hospitals are going to get, a big check for taking care of all of these coronavirus patients, and that's not really going to happen. The income stream that keeps the hospitals open comes from elective surgeries, and if they don't have that, that's a real problem. I think another thing that's really quite scary is the lack of personal protective equipment that exists in the hospitals right now. And I'd put this plea out to your viewers. If you have N95 masks, don't hoard them. If you bought them, and they need them, and that needs to, if you hoarded them, no harm, no foul, just go donate them right now. That's the right thing to do, because there are, I was reading some reports out of New York hospitals, and there are people that are taking their N95 masks and stapling them back together because they broke. There are people who are trying to make their own N95 masks. as best they can with saran wrap and cloth and tinfoil. This is happening right now. It's happening in the United States.
If a viewer has some of these, where do you take them?
Well, the first thing I would do is call up local hospitals and ask them exactly where to go. You know, we don't want people just showing up to ERs with a bunch of N95 masks. I mean, that's a nice thing to do, but it may not be the best way to handle that. But calling up the hospital and saying, hey, I'd like to donate these, where can I go, would be the best way to do that.
Okay.
Today, at a news conference that the governor organized, we learned that the state hygienic lab in Iowa City has 800 tests. At UnityPoint, could you use all of those tests? I mean, how many tests does the state of Iowa need?
Well, at UnityPoint, we are also using one of our commercial vendors to send out tests so as to not overwhelm our hygienic lab. But even that comes with some issues because the turnaround time is 2 to 3 days. So what happens is that if you have someone that you are investigating for coronavirus, you need to put them under the appropriate isolation precautions and send the test. And while you are waiting for the test, you are consuming that personal protective equipment. So having the ability to test in-house so that we decrease our turnaround times is something critical, and it's something that across the United States has not been possible yet. Yes, national reference labs have been offered as a solution, but they are not.
Dr. Crosbie, there are also in Iowa protocols. You test patients in the hospital, you test healthcare workers who've come in contact with a patient who has COVID, as well as first responders. You test people who have been to one of these quote-unquote hot spots like China or Italy. But a lot of people are not meeting those protocols. Do the protocols need to be changed?
I don't think that, even if you did, it wouldn't change anything. So right now our protocols are the things that you mentioned, but if somebody walks in to our clinic with a fever and a cough and a negative influenza test, that's our protocol for testing for COVID-19. The problem is, it's not just the test kits that everybody's been talking about on the news. The way it works is if you walked into our clinic and you'd been out and about and now you've got a fever, 102-degree fever and a bad cough, we test you for the flu, you don't have the flu. At that point, we all go, okay, now we need to worry about testing for COVID-19. We get this swab, and we swab this, and it's a nasal thing. It's kind of gross, and nobody likes it, but there you go. And you send that off to either the state hygienic lab or there's a place in Missouri where we're sending them to. There's two sticking points here. There's the swabs, which our clinic only has 18 of for our entire clinic. There are some clinics that only have, I think you said 4. And there's the sticking point of the testing kits that you need to use to take that sample and work that out. We don't have enough of either. And by the way, those swabs have been on back order for 6 months.
Jennifer Nutt, swabs, test kits, 800 tests was what the statistic released today. That's not enough.
We are hearing from a lot of our hospitals that they do not feel they have enough tests at their sites. And they're following the protocols they're supposed to be of who to test. And because if a hospital were to test a patient who does not meet that criteria, the state hygienic lab will not run the test. They're only running the test for the appropriate people to help ensure resources are being used appropriately. But that is a concern for the hospitals to have enough tests, so when they do have the appropriate patient to test, that they have the resources to do it. And as he spoke to, it's the swabs and the mediums and everything to get it to the testing sites.
And I would add to that also, in order for our nurses, our providers to test the patients in a safe way, they also have to don the appropriate personal protective equipment. So we also worry about that, so you need the equipment, the swab, the kit, where to send it. It's a whole process.
This also speaks to sort of the overarching point here of people really need to take this very seriously. don't need to be scared, but you do need to be serious about it because of all of these shortages of both personal protective equipment, test kits, and everything. It's really on us now as the public to do the right thing and to try as best we can to stop this spread because we're out of the stuff.
Dr. Nutt, explain to me ventilators and the shortage there. We've been talking about test kits and swabs and stuff. Now, if you get patients, critically ill patients, and need a ventilator to keep them alive, and how many of those do we have in Iowa, and are there enough?
I don't know the exact number off the top of my head of how many there are in the state, but that is something that hospitals are keeping track of on a daily basis. We're working to identify who has open beds, if they're medical surgical beds or ICU beds, but also keeping a track of ventilators across the state. And there may need to be a point where hospitals are having to share with each other and get patients to where they can be taken care of. But it's another resource we're keeping a close eye on at this time.
Dr. Ross, how many?
At UnityPoint, we keep constant track of the number of ventilators that we have. That number actually fluctuates throughout the year because we do, whenever we anticipate flu season getting worse, we actually, make some arrangements to our stock. I also can't give you an exact number. I can tell you that at this point, so far, we have the capacity to take care of our patients. But there's actually 2 points there. Number one, it's not only the machine, it's the staff. Having the staff that are qualified to use that machinery. And the other thing is that just because right now we might say we have enough stock for this or that, if the cases peak to a point that is beyond our capacity, nobody will be prepared.
Okay.
Dr. Nutt, in terms of the staffing issue that she brought out, what is the average age of a nurse or a LPN in Iowa?
The average age of nurses is getting older. Right now, part of my position at IHA as well, I work closely with the Iowa Board of Nursing on nursing issues. But we are getting younger nurses coming in. We do have retiring nurses coming out, but the average age is around, I want to say the highest peak was between 40 and 60.
So are you concerned about having that cohort who's been told, hey, you're at risk, working on this effort?
Yep, and that is a concern of a lot of our hospitals as well. They're reaching out and they're asking, how do we manage our high-risk staff? Not just the high-risk patients, but high-risk staff, and what's the guidance for them?
Dr. Ross, you mentioned that we're not at the worst of this yet. We have a graphic on your screen showing the bell curve. There's been a lot of talk about we had to flatten the curve. Can you explain to our viewers what's going on there in this curve?
Yeah. So what we see, is essentially this type of pandemics, this type of infections, tend to grow at an exponential rate. So the number of cases doubles, quadruples to a point that it can just absolutely overwhelm the health system. If we don't take enough measures, protective measures, such as social distancing, the number of cases will continue reaching that peak to a level that will be beyond our capacity. When we talk about flattening the curve, what we talk about is taking measures that will actually slow down, break down that chains of transmission. So it's not that one day we're not gonna, you do this and then 2-3 days later you have no more cases. It's about decreasing the number of cases so that they remain below a level that is actually manageable. It's mitigation. It's not elimination, it's mitigation so that we can handle what's coming.
Dr. Crosbie, Iowa is not as densely populated as places like Seattle and New York City. Is that a benefit?
Yeah. I would say Iowa's been relatively insulated from some of these things. Actually, if you can put the graphic back up, if you look at that graphic, and please stop me if I get this wrong, the reason that graphic's important is if somebody has coronavirus pneumonia, basically what we have for them is give them oxygen, and if they get bad enough, put them on a ventilator. That's all we got. We don't have a miracle drug. We don't have. They're working on some things. They're trying some antivirals right now. There's discussion about Plaquenil, but that's not going to be a miracle drug, I don't think, anyways. I mean, in theory, it's nice, but they're going to use it to see whether or not a large sample will improve. But the red part of that curve, if we get above that line, we don't have enough ventilators to put people on, and that's the only thing we've got. If we stay in the blue part of the curve, we've got people, they go on the ventilator for a few days, they get better, they calm down, they get off of the ventilator, and now the ventilator is available for another patient who's ready, who needs it. And that's the flattening of the curve. That's why the spreading out of the sick patients is so important.
Dr. Rosa, and I apologize, I mispronounced your name several times tonight. In that curve, we talk about spreading it out. You say we've not reached the worst of this, and we've got to spread it out. So how long do you think this is going to go on?
We don't know. We just don't know. Nobody has an answer for that.
Is
And
there...
we have to keep that in mind. We just don't know.
And the Chinese are reporting in Wuhan that their cases have flattened out. Do you take any encouragement from that, or?
I do, and actually it's been the first time that they have actually not reported any new cases. That is certainly encouraging. However, one has to remember that the measures that were taken in China were far more strict than the ones that have been encouraged here. In China, it's not only that patients who had mild disease were told, okay, go back and stay home. It's if you have mild disease, you have to isolate yourself from your family, because we know that it's close family contacts that are at the increased risk of having worse outcomes. Now, I want to bring it a little bit to the makeup of the Iowa demographics. Yes, we may be less densely populated than, say, New York or California, but we do have a population that is that the age skews towards older, and that is very concerning in terms of the mortality rates that we could see.
You mentioned China, so let's just dive in and talk about some of the things that you mentioned they did. The segregation. If you're sick, you don't go home and spread it to the other people in your family. You go somewhere else. Dr. Crosbie, the other thing they did was they had what they call fever clinics. So you weren't actually going to a hospital. You were going somewhere else. Are these drive-through clinics, which are popping up around the country, including in West Des Moines and Davenport and Mason City in Iowa, is that replicating the Chinese experience, and is that the way to do it?
That was a pretty good idea, I think. I thought that was an excellent use of the resources we have here, because everybody's in their own car, they're not interacting with anybody. I thought that was taking a good advantage of Americans' love for automobiles. That was pretty solid. One of the big problems, and please correct me if I'm wrong, is when you look at the difference between SARS and COVID, is the difference in the presentation of the symptoms. There's a wild variability in the presentation of symptoms with COVID-19, and that's a major problem in terms of containing an outbreak. If somebody got SARS, they were good and sick, and you looked at it and you said, oh wow, that person's good and sick. So to kind of put it in a different way, let's say we had two groups of 25 people, Group A and Group B. And all 25 people in our Group A had SARS, and all 25 people in our Group B had COVID-19, but we didn't know that. And they just walked into our clinic. Well, 23 of our 25 in Group A are going to be really sick. And we're going to look at that and we're going, oh, wow, they're really sick. We should test all of them for SARS. And so we do, and we find 23 of the 25 have SARS, and we go, that's not good. And then we test the other two just in case. And now we know all 25 people have SARS. We quarantine all those people. We keep them away from spreading the disease. That's not what happened with Group B. With Group B, only 4 of them or thereabouts looked really sick. And we only tested the 4. And the other 21, well, they just have mild symptoms. They've got a little bit of a fever, a little bit of a cough. Well, you've got something viral. You're contagious. Go home. And, of course, we all know that not everybody just goes home when they're told they have a virus. They go back to work because they're worried about making a mortgage payment. They don't want to take their sick days. Or they go to the grocery store and get some comfort food because now they've got a cold.
Doctor, you mentioned in your hypothetical the idea of people showing up to be tested. For the record, I understand that's the last thing you folks really want people to do, correct?
Correct.
Correct. At this point, we don't want a whole bunch of people all showing up again because that widely variable presentation of symptoms, it's really, really hard to know who has it, who doesn't.
Jennifer Nutt, there are some people, despite all the things that you experts are saying this thing is overblown. You can go on social media and find all kinds of theories and odd things. Are we in the media overblowing this thing?
No, I don't believe you are. And I think an unfortunate part to a lot of people who do feel it's overblown, those are the ones who aren't necessarily taking this social distancing seriously because they're like, this is crazy. I'm going to go do what I need to do. And the social distancing and why it's not overblown is it's not always about the person. It's about who that person has contact with until they're in contact with someone who's at higher risk of this being a fatal illness for those people. So it's a bigger picture of protecting the vulnerable people within our populations. But no, I don't believe it is overblown.
Okay.
School's out, and so parents are searching for childcare. Parents have been told, don't send the kid to grandma and grandpa's. The other thing that people are being told is to check in on seniors who are maybe closeted in a house and haven't seen anybody in a long time. What questions would you recommend that I ask my elderly neighbor or an elderly mother to really understand if they're healthy? Yeah,
that's a great question. And I can speak to this. I have a grandmother living in assisted living. We can't go and visit her, so it's the same situation. But it's asking first, basic questions. How are you feeling? How are you doing? Are you getting up every day? Are you showering? Are you getting dressed? Are you eating your meals? And then it's asking if they have the supplies they need because a lot of people can't come in or out. And so do they have the food? Do they have enough medications? And spending some time talking because we are going to see an increase of some mental health issues arise with people being so isolated.
Dr. Rosa, in most of this society in this country, when a kid gets sick, you'd love to go see grandpa and grandma. And as I understand what you folks are saying, that's the last thing you want to do is go give grandpa and grandma a hug or get a hug from them.
Yes, we are really discouraging folks from doing that because we do know that the largest cohorts of patients, the studies have come out, have shown that elderly patients are at risk for worse outcomes. The highest mortality rates are seen in those that are over 65, and the worst of the worst really on those over 80 as well.
We're starting to get some questions now from our viewers, so Kay and I will start firing away with some of those. Kay, do you want to start?
Sure. Randy from Charles City has a really interesting question since we've all been told that blood supplies are running low. Once someone is healthy after having COVID, is it okay to donate blood? Anybody want to field that one?
I think, so there's a few things. This goes to a few things, right? So I guess the question in part is, will I become immune against this virus? And how long is it transmissible? And both are questions for which we are still trying to find a definitive answer. In general, when you acquire an infection with a virus like this one, you go on to develop immunity, but we do not know how long-lasting that immunity is. And another question is, for how long does a person shed the virus? How long is it in their blood? And that's another thing that it's still in the process of being, sorted out. For some folks, it can be for many weeks. I do think, our blood banks they all follow very strict regulations. They frequently well, they actually have to screen for certain diseases, and we will actually see if in time they get any type of guidance from CDC or from other entities in terms of the screening they might need to do for the blood that they receive.
Also, we have a question from a viewer named Doug in Fort Madison saying the World Health Organization has tests. Why aren't we in the United States using them?
Jennifer Nutt.
I have not heard that exact statement that the World Health Organization has tests, so I can't speak to that directly. I know in the state, the Iowa Department of Public Health is working to get more tests and testing supplies in our state, but along with many other states in the country as well. Since we are not the only state in this situation, supplies are going to be divided amongst all the states.
Judy in Coralville says 600 negative tests. Does that mean they're over-testing? Why are they testing so many?
That doesn't actually mean they're over-testing. Those people who got tested, those all went through the state hygienic lab, so they met the criteria for testing. The Department of Public Health is just showing those numbers so people can see how many negatives to how many positives, so the ratio of people testing positive compared to those testing negative. So I don't think we're ever testing. It's just the right people. It's just how many people are positive.
I do think that the state, our Department of Public Health is trying to be very judicious with the guidelines that they have put out in terms of who should be tested.
Well, they have to be if they don't have enough tests.
Yes.
Dr. Crosbie, you mentioned, we talked a little bit earlier about what you do if you feel ill. Here, Carolyn from West Des Moines calls and says, if you can't get through to 211, which is the phone number you're supposed to call at the Department of Public Health, what do you do?
Well, the first thing I would do is call, not go into call your healthcare provider. I mean, if you have a family doctor or an internist, or if it's your kid and you have a pediatrician, I would call their office first and give them exactly what's going on. The big thing here is whether or not people are in respiratory distress. If you've got a fever and a cough, but you're breathing okay, you're not short of breath, this is pretty encouraging. I would not go in to be seen until you are short of breath. And I think that's probably a fair...
I would say, though, that, one other thing that I would say, though, is that if someone, there are other options besides office visits. At UnityPoint Health, we do have a virtual care platform, so that is something that should also be considered.
We've also started, lots of different places have been doing e-visits and telehealth and things like that, and that would be the way to go. Yep. So if you're starting to have shortness of breath, that would be the best way to handle that.
Okay.
Perhaps because of your interaction with hospitals, you can field this question from a viewer who was too shy to give their name and their home. And I grew up in a household where cleanliness was next to godliness. But this viewer wants to know, what are the cleaning products? Do I have to clean my entire house with a product that's at least 60% alcohol to get rid of the virus if somebody in my family has it?
So the 60% alcohol usually relates to the hand sanitizer. Right. But cleaning your house with your Lysols, your bleaches, and you can read on the back of the cleaning container, what it kills. But at some point, yes, you want to do your whole house, but most importantly is your commonly touched surfaces. Your doorknobs, your handles on your refrigerator, your dishwasher, light switches, the things you touch most frequent. And that way, if you're washing your hands and keeping things clean, it should keep the germs down in your house.
Clean your phone
every day,
yes.
often.
Yes.
And that includes your smartphone.
Yes.
Well, that's the only phone many of us have.
Yeah.
Although the biggest, and we've all sort of said this, but the biggest thing you need to clean is your hands, over and over and over. And soap and water does wonders on this. The virus itself is enveloped, and enveloped viruses have a layer sort of around the outside of them, and enveloped viruses don't hold up well against soap. So we can kill the virus with soap and water, and that's a very good thing.
We have a question from Wanda in Ottumwa. Are the mail-in groceries that are being delivered to me by someone else safe for me to touch?
I think just like if you were to go to the grocery store, you bring your groceries in your house, you put away your groceries, you need to wipe down your counters where those grocery sacks were at, because many people have been touching those grocery sacks. And once your groceries away, you wash your hands. Now you still have someone else coming in your house, so that is a little more of a risk, but for many people that's their only option to get groceries. but you just wipe down your counters and wash your hands.
Another,
If they are in perhaps plastic containers, you can consider sanitizing the container in which some of those, products might come as well.
I think that might be the advice to our reluctant viewer who didn't give their name as well about we're all encouraged to order takeout to help small businesses that have been closed and they can't have people in the restaurant because of the limit on the number of people who can congregate. Is it okay if they bring it to my house and leave it?
I think we also have to take precautions once those bag products arrive, no need to shake hands with the person that delivered your meal, sanitize the bag that something comes on, wash your hands before you eat your meal, before you touch anything else.
Dr. Rosa, Lenny from Adel, going back to hospitals here for a moment, what are the protocols for patients with conditions other than COVID-19? Isn't our system already stretched too thin?
Well, yeah, our systems, and actually, again, our systems are stretched thin, and we have also been battling cold and flu season, so that, also takes into some of our resources. We are not turning away patients who have something that does not sound like COVID. We still continue to take care of our patients, and we'll continue trying to do so to the best of our capacity.
This has kind of already been answered, but David on Facebook wants to know, is it really effective to wash my hands with soap and water?
Yes.
And to wash them properly.
You were
for
just talking about
20 seconds.
Yeah.
It's like proper washing.
Yes, not just some cursory.
No, proper washing.
Washing and getting underneath your fingernails,
Yep.
Well,
making sure you get your thumb. There was, one other thing that I think sort of speaks to what Dr. Rosa was talking about, which is the treatment of other things.
Yes.
This is a really good time to underscore the importance of getting your flu shot. If people get their flu shot, we know that will lessen hospital admissions. And if everybody had gotten their flu shot this year, we would have more beds available for this. And this is just a really important time to bring up the importance of getting your pneumonia vaccinations, getting your flu vaccinations, so that if something like this happens again, because something like this will happen again at some point in human history, because as long as there's humans on the planet, we're going to have viral outbreaks. We can save our resources because those types of things are preventable.
Dr. Rosa, I have another question here. Travis from Des Moines. We talk about washing hands. Show us how we're to wash our hands.
Oh, do we have?
We don't have water, but...
Well, what I'll say is that when I wash my hands, right? So first the 20-second rule, but I actually, it's about going through, all the nooks and crannies in your hand. Spread the soap throughout your palms, and then go actually finger by finger, and then scrub each finger, each one of them. Scrub your wrists. I also dab a little bit of soap on the on the faucet, and then on the knobs, so that you also clean that surface. And then when you let the water fall down, you put your hands down, and then the water falls, and then you shake, and then you sprinkle some on the sink as well, and then close without touching again.
Don't forget your fingernails.
Yes. Oh my gosh. Yes. Fingernails.
If you get some soap right here, and then
thank you.
Rub like so that you get underneath the fingernails.
All right. Jennifer, Nick asks, should daycare and child care centers be closed?
I don't know if I can answer that question. I know that it's a big decision to make, because when that does happen, there's an impact on the workforce. So even closing schools has made an impact, and specifically on the healthcare workforce, and we need all of our healthcare workers being able to attend work. So I don't know if I can say if they should or shouldn't, but it's a big decision to make, especially on the impact of workers.
Same question.
Yeah, same thing. I think that our public health authorities are continuously monitoring this, advising our governor so that they make the right decision at the right time.
Laura wants to know, can my kids continue to play with their neighborhood friends if there are only two of them and they come from the same house?
This is difficult. I can tell you personally that it's very difficult too. I have a 2.5-year-old, and she tells me that she wants to go play with our next door neighbors. And, right now might not be the best time to do that. Social distancing is about, staying apart, staying away from other folks, they're not from your household. At least, have to stay at least 6 feet away from them. I've started to end my my patient visits by telling my patients, you know what, this is hard, but if we stay apart, we'll overcome together.
Okay.
We have a viewer from Marcia Ames. If she's living in a senior facility, she said, if I get sick, what happens to my husband?
That's a risk, especially in older adults and living together. And I know, depending on how their facility is and their spacing set up, if she does get sick to the point where she can stay at home and manage the illness, staying in a bedroom, making sure they're washing hands and cleaning surfaces, not sharing the same bed if possible, do it the best you can in the space you have.
Another sort of related question from Tom and what Cheer, asking about nursing home facilities specifically. And if a patient there gets sick, do the nurses need to start wearing protective gear then?
So if a patient were to test COVID positive in a nursing home facility, they would put the patient in isolation, just similar that would be done at a hospital. And that's why they're also now within the testing criteria, healthcare workers can get tested. So then if there's a healthcare worker who is running a fever and they have COVID, they would test the patient, but they'd put them in similar isolation just as they do with it. But that's why our long-term care facilities have completely shut down for visitors in and out to help protect that population.
I would add to that, though, that nursing homes, long-term care facilities have stayed in contact with the hospitals that they tend to, have relationship with,
right.
so that they have plans so that if a patient actually needs to be transferred, that transfer occurs in the safest way possible.
We earlier mentioned those drive-through testing sites. I don't know who can best answer this, but Chris in Windsor Heights said, what are the criteria for being able to use that site?
So from my understanding, and there's some more popping up around the state, it's still going to be the same testing criteria. So as we spoke to earlier, fever with contact, healthcare workers, the same criteria to get tested. The goal is just to keep people out of the healthcare system, out of the clinics, out of the hospitals, and test them in a safe manner.
And you still have to call ahead.
Yes.
Yep,
you still
lots of them have call
ahead
ahead screening process, and then in other states, how they're set up, you call ahead and screen, and they'll give you an appointment time to come to the drive-through.
Dr. Rosa, are people in Iowa tracked once they're tested? Where do rural people go to get tested? That's Audrey from Bode.
Yeah, so at UnityPoint, we have a network of clinics across our state, we've issued guidance to our clinics and throughout our hospitals as to how to go about trying to meet the testing and evaluation needs for patients across the state. It might be about if you're feeling sick, if you're feeling that you should be tested, you should call your local clinic, whatever that's closest to you, and try to sort out, can they test you? Depending on who is performing the tests, there will be tracking, and actually all the positives are getting reported or would get reported to our state health authorities.
Another follow-up question here. Who does the mask protect? Does the mask protect the wearer or those in contact with the wearer? And that comes from Ann from Altoona.
Well, both. In terms of, if you're walking around and you don't have any symptoms and you have a mask on, that's kind of a waste of a mask. If you're in a hospital and you're working in the hospital and you're a healthcare worker, that's the asymptomatic people who need the masks.
Yeah. So in order to further dive on that question, we have to understand how is the virus transmitted. The virus is transmitted by droplets. Droplets are small particles that are put out there into the world by people when they are coughing and sneezing, right? So if a person is sick, they should wear a mask. First of all, if someone is sick, really the best thing is to actually stay home. Sick, I mean, without needing, a further cares, right? But if you're feeling sick, you have a cough, a fever, it's better to stay home. But in a clinic, you know, if somebody presents to our clinics, we would put on a mask so that we prevent those droplets making it out into the world. In the hospital, the type of precautions that we use for these patients are both masks and masks either with a face shield or with goggles, so that we, because we, you know, perform tests, examine these patients, have to do cares that put us in very close contact with these patients, we have to protect ourselves from those droplets.
Jennifer Nutt, will the warmer weather cause the virus to die off, like when summertime comes? That comes from Ken and Waukon.
To my understanding, not necessarily on this one. I'm going to defer to these guys. But yeah.
I would say we should not expect that. If that were the case, Florida would not have any cases right now.
If that were the case, Tom Hanks wouldn't have gotten it in Australia.
Summertime.
Mary in Guthrie County wants to know, South Korea is testing 10,000 people in one day. Why is Iowa limited to 400?
Yeah, so yes, testing is one of the biggest problems that we are facing. You know, very early on, the preparations for this pandemic, CDC decided to keep testing centralized. And I should also add to that the commercial vendors that most hospitals use also did not seem to get on board with production for reagents and things very early into that process. So then we were left without a way to test, and even now when we are going through reference labs, turnaround time is not what we would desire. And even at these reference labs, they are experiencing tremendously high volumes. It's not because when somebody comes to us and says, I have a fever, I have a cough, but they may not fully meet testing criteria because, they're under 60 or they don't have any chronic conditions. It's not that we don't believe you. It's not that we don't want to test you. It's just that our resources for testing are very limited. And so we are trying to catch the cases that are most likely to have it, or that if they have them are at the risk of the worst outcomes.
Jennifer Nutt. Dick from Cascade has an interesting question. We've been talking about a pandemic coming for 4 or 5 years. Why wouldn't our government stockpile all of the medical supplies we would need for a pandemic like this? Why weren't we more prepared?
So we do have stockpiles. We have a state stockpile and there's a national stockpile. One issue with the stockpiles, which has been discussed, is the last time that they were really filled was in 2009 when we were doing H1N1. And so now going through the supplies, some of them have expired because some medical supplies, even unused, are expired. And so the Iowa Department of Public Health is having to go through those to determine what can still be used and in what manner. And then with the national stockpile, we have access to that too as needed, but it's a similar issue as some of the supplies that we are getting are expired supplies, so it's having to be sorted through, and the supplies that can be used are getting spread to the counties and areas that have the highest need.
Doctor, what about Dick's point? Why weren't we more prepared?
Oh, that's a question I'm afraid probably nobody here can answer. I would say that this preparation was something that needed to happen years ago, and that a plan needed to be in place such that when a novel virus was coming out of a new place, when they gave us the genome, we should have had the private companies that we outsource this stuff to on high alert, well, not high alert, but on board, ready to go, ready to make our tests, ready to crank out tests when we started getting these things, and that just wasn't done.
Well, thank you. Just so Dick knows, we have a lot of politicians on this show from time to time, and we'll follow up that question with them.
That would be a good choice.
Okay.
Sue Ellen from Iowa City asked a question that maybe some grandparents are worried about. Family traveling for spring break, they come back. Do I need to stay away from them for 2 weeks?
Yes.
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 Sadly, yes.
Hearing the doctor say, call your family doctor, what happens if you don't have a family doctor?
So this is one of those situations when you may want to call 211. and also try to, another option would be to access a virtual care platform.
I have a question for each of you. What about you personally as a healthcare professional? Do you feel like you've been prepared well enough to deal with this? We're running out of time, so a short answer would be face masks, preparations.
I would say that where I work, they started to get a little more nervous about this than I was before I was. So I would say that our institution did a pretty good job of saying, hey, we have to, we got to get after this. And as far as getting us all of the stuff, I mean, we're at Des Moines University, we're outpatient, so we're relatively insulated from this as well. I think probably Dr. Rosa would speak
at
to this.
UnityPoint, and probably this is true across hospitals, we do have emergency preparedness committees. I am part of that committee. We meet on a regular basis, check our stockpile, make sure that our protocols and procedures are in place. And we've been preparing, but this is beyond what anyone can be fully prepared for.
And I'd piggyback on that. All of the hospitals do, they get federal money every year to work on preparedness, so hospitals are prepared. And we have 12 different healthcare coalitions our state's broken into for preparedness reasons. So the systems are there to support it, but as she said, it's just bigger than what people thought.
The systems, the structure, the people, everyone knowing where they need to go when needed, that is there.
So Larry from Red Oak asks, if you're afraid you won't be treated and you don't have any money to pay, should you go to the emergency room? What should you do if you don't have insurance?
I can answer that one. If you're having symptoms, I know that places are waiving all copays for the discussion of everything that's happening right now. If you don't have any insurance, I would not go to the emergency room unless you are in a life-threatening situation. If you don't have any insurance, you can call up various telehealth platforms that can give some advice and can get that patient treated.
What advice, Morgan from Ottumwa wants to know, should you give expectant moms?
Well, right now, we have not seen any worse outcomes amongst pregnant women who have had COVID during pregnancy. Hospitals have developed protocols to manage pregnant women with infection, and so that they can take appropriate care of baby and mom.
We got a lot of questions and not a little time, not very much time. Jan from Urbandale said, I'm in independent living, but I have a healthcare worker come in. Is that okay?
As part of their...
For PT or helping with chores?
Yes, but take precautions. Everyone take precautions.
As we're wrapping up, and Kay, keep looking to see if we have other questions here to get in. I'd like to just go around the table quickly. There's a lot of misinformation flying around here. What's the biggest piece of misinformation that you've heard that we can correct? Jennifer Nutt, would you like to try that one?
Yeah, I think a lot of people are getting their information from social media. I don't know if I can pick a specific one, but I've seen different ways to prevent from getting it, drink this or drink that and all these weird remedies. But when people are getting information, they need to go to legitimate websites, the Iowa Department of Public Health, the CDC, CMS, and make sure the information they're getting is accurate, because it just keeps getting spread and all over.
Social media.
Yeah.
Well, I would say though, at UnityPoint Health, we try to use our social media channels for good. So same thing. I can't give you a worse example, or perhaps the one where somebody told me that they read that drinking bleach could, protect you. Do not do that. But yeah, I would echo that. Go to CDC, go to. Radio Iowa.
Thank you.
Iowa PBS. Trust, sources that are trusted.
Yeah, the one that I can think of is the gargling with vinegar and warm water will make it go. No, it won't. And UnityPoint Health is not going to put that information out there, so you can go to there. I think maybe the biggest piece of misinformation out there is that this is not a big deal. That would be the biggest problem right now that's sort of circulating around. I read the comments section on the internet, which of course is one of the worst things that you can ever do in the history of the world. And there's people who just don't take it seriously. That's a major problem.
Dr.
Okay.
Rosa, really quickly, Diana wants to know if I took the pneumonia vaccine, does that help me lessen the symptoms?
Well, the pneumonia vaccine will protect you against a bacteria that most commonly causes pneumonia. The influenza vaccine will protect you from influenza. You want to be protected from these things, which at the end of the day are still very common, but they do not protect you from coronavirus. This is a new thing, a new virus. Nobody has immunity against it.
Elizabeth from Cedar Rapids, we have less than a minute. So I got my flu shot, but my daughter cannot get a flu shot due to an allergy. Can she get any additional protection other than social distancing?
I'll probably defer to you on that.
Yeah, so there are different strategies for people who cannot get an influenza shot, and they can review all of those ones with their pediatrician. They are certainly at risk for for influenza, certainly worse outcomes. But right now, social distancing, washing your hands is one of the best things they can do.
One of the few bright spots here is that children have been remarkably spared. And so that I hope that'll provide a little bit of reassurance. The pediatric population has been doing pretty good here. So.
I know we're very, very short on time, but there's one thing that I think it's very important that we all keep in mind. The measures for social distancing were implemented in Iowa when the number of cases was low compared to other states. My hope is that we will be able to flatten the curve here in Iowa. So it is important that if we actually see those numbers kept low, we don't feel disheartened and we don't feel that this was all for nothing. It will be a sign that it worked.
We're out of time. I want to thank the three of you for spending your time with us and for the work you and your colleagues are doing all across the state. Thank you very much. And I want to thank our viewers for all your fine questions. I'm sorry we were not able to get to all of these. And we'll also cover the economic fallout of the coronavirus pandemic on our regular edition of Iowa Press this week. We welcome economists Ernie Goss of Creighton University and Peter Orazem of Iowa State University. The economic impact of COVID-19 on Iowa Press at our regular times this weekend. Friday night at 7:30 and again at noon on Sunday. So for all of us here at Iowa PBS, I'm David Yepsen, and thank you for joining us tonight.
Funding for Iowa Press was provided by Friends, the Iowa PBS Foundation, the Associated General Contractors of Iowa, the public's partner in building Iowa's highway, bridge, and municipal utility infrastructure.
I'm a dad.
I am a mom.
I'm a kid.
I'm a kid at heart. I'm a banker.
I'm an Iowa banker.
No matter who you are, there is an Iowa banker who is ready to help you get where you want to go. Iowa Bankers, allowing you to discover the genuine difference of Iowa banks.